Hello learners. I hope you are doing great. Did you know about the breast? So keep an eye out, and learn about. Breast's most important prominence is located on the pectoral region or thorax, that serve several functions, including lactation, sexual attraction, and insulation. Both females and males develop breasts from the same embryological tissues, but it is rudimentary in the males, and well developed in the females after puberty. In females, it serves as the mammary gland, which produces and secretes milk to feed infants. In this article, we shall look at the anatomy of the breast. The breast is a modified sweat gland. It is principally composed of adipose, glandular, and connective tissues. Because these tissues have hormone receptors, their sizes and volumes fluctuate according to the hormonal changes. Location of the breast. The breast is located on the anterior chest wall, just above the rib cage. It lies over the pectoral fascia, which is deep fascia covering the pectoralis major muscle. It is separated from the pectoral fascia by loose areolar tissue, called the retromammary space, due to which the normal breast can be moved freely over the pectoralis major. The breast extends vertically, on average, from the level of the second rib to the level of the sixth rib in the front of the rib cage. Horizontally, on average, from the lateral border of sternum to the mid-axillary line. Thus, the breasts cover much of the chest area and the chest walls. Morphology of the breast. The shape of breast is hemispherical. It is divided into 4 quadrants, namely, upper medial, upper lateral, lower medial, and lower lateral. A small extension of upper lateral quadrant, called the axillary tail of Spence, passes through an opening in deep fascia, and lies in the axilla. The opening is called foramen of Langer. Structures of the breast. Breast consists of glandular tissues, adipose tissues, and connective tissues, as well as several other structures such as ducts, lobules, and ligaments. Glandular tissue. The glandular tissue is made up of mammary glands, which is a compound tubuloalveolar glands, responsible for producing milk. The mammary glands are organized into 15 to 20 lobules. Each lobule is a cluster of alveoli, which contain milk-producing cells. The milk produced by the glands is carried to the nipple by small ducts called lactiferous duct. Adipose tissue. The fatty tissue surrounds the glandular tissue, and helps to provide shape and support to the breast. The amount of fat in the breast can vary greatly from person to person, and can also change throughout a person's life, such as during pregnancy, lactation, and menopause. Connective tissue. The connective tissue holds the glandular and fatty tissue in place, and provides additional support to the breast. This tissue includes ligaments, which attach the breast to the pectoral fascia and provide stability, which known as suspensory ligaments of Cooper. Nipple and areola. Nipple is a conical protruding structure at the center of the breast, at the level of 4th intercostal space, and 10 cm from the midline. The nipple is capable of becoming erect, which is important for breastfeeding. Nipple is surrounded by a pigmented, circular area of skin called the areola. Areola contains modified sebaceous glands, which become enlarged during pregnancy and lactation to form raised tubercle of Montgomery. Oil secretion of these glands lubricate the nipple and areola, and prevent them from cracking during breastfeeding. Blood supply of the breast. Breast is extremely vascular. It is supplied by following arteries: lateral thoracic artery, internal thoracic artery, lateral mammary branches, medial mammary branches. Veins follows the arteries, which are internal thoracic vein, afferent mammary vein, Lymphatic drainage of the breast. The lymphatic system is an important part of the anatomy of the breast. It is responsible for carrying waste products and excess fluid from the breast tissue. The lymphatic vessels of the breast drain into nearby lymph nodes, which help to filter and monitor the breast for any potential cancer cells. Thanks for watching. If you learned from this video, then like and share with your friends. For more such content, kindly subscribe to this channel. And for latest updates, click on the bell icon.